people need?
Unfortunately, Elizabeth, I absolutely do think stigma is still an enormous issue and is a barrier in all sorts of ways to people getting the care that they need. And it's complex stigma, and it becomes more complex when the stigma is intersectional. And unfortunately, I think we've had 40 years responding to HIV now, and whilst we've done incredible things in other spaces, stigma has continued to be one of the key issues that we've really struggled to have an impact on. And that, unfortunately, it remains one of the biggest issues that leads to people becoming HIV positive and to barriers to treatment and care over time.
What do you think, Darryl?
As Scott said, it's such a profound experience, particularly for people with HIV, to wonder or to worry about what others are thinking, how others might be judging them having HIV, to be wondering, if I tell this person, what will that mean? This relationship is important to me, this person is important to me. But it's actually not just about how people feel. It's a very practical thing. So stigma is the thing that stops any of us from feeling comfortable to say to a doctor, I'd like a HIV test, without anticipating what will the doctor think? What will the doctor ask me? Will I need to explain why? Stigma is the thing that stops the doctor from offering us a test because they don't want us to think that we're being judged. So it's very practical. It actually creates all sorts of problems and all sorts of barriers to us actually accessing the kind of supports, the kinds of care that we need in easy ways where we're not fearful of how that will be perceived or judged by others.
I remember when universal precautions were being taken up and people started to wear gloves. I know I didn't wear them, and then suddenly you're wearing them, and people would say, you don't need to put gloves on me, I'm not going to have any of those things. So they almost felt that there was a stigma in people even assuming a universal precaution was a good thing to do. And that has changed so much now. No one would think twice about someone wearing a mask, goggles or gloves, that notion that we just keep everyone safe and there's no judgment involved in doing that.
And that, I think we need to run with that idea, because that's like universal precautions. We don't try and guess at who's got this condition or that condition. We just assume everyone might have a condition, and we take the right steps to actually make sure that we're doing that procedure well as healthcare workers. But what if we took that further? What if we actually took a universal precautions approach to the possibility that the person we're working with might have any range of different things happening for them that we can't see. Maybe they're particularly frightened of doctors. Maybe they're particularly frightened of getting work on their teeth done. Maybe they feel really embarrassed about this situation that they have that they're coming to see you about as a health professional. There's all sorts of reasons why people can be anxious or fearful or avoidant, often for very good reason. But if we took a universal precautions approach in which we were respectful, we asked questions, we were non-judgmental, we didn't make assumptions, that would make it so much easier for all of us to be able to access healthcare.
Just perhaps say a word about World AIDS Day for us to finish off with.
Each year, World AIDS Day gives us an opportunity to do many things. Of course, it's an opportunity to go back in time and remember the place we've come from. But these days, it's particularly an opportunity for the community of people with HIV to gather, and there is the flip side of the experience at this time of year, but that's a wonderful way to mark, for me, to mark World AIDS Day, is to spend time with my people, and it's incredibly valuable for me and the rest.
Yeah. Darryl?
I think for me, first of all, World AIDS Day, we celebrate the resilience and the strength of people who are living with HIV, 30,000 people in Australia who every day are navigating their experience of HIV. Nearly all of whom are taking treatment that actually keeps all of us well, because treatment for HIV prevents HIV transmission. And so not only is it good for people with HIV's health, but it's actually what's keeping HIV rates in Australia so low. So we have so much to be grateful to people with HIV for. But it's also the moment where we remember the devastating losses of the epidemic. We lost 10,000 people in Australia to HIV and AIDS since the beginning of the epidemic, and so many of them were actually young people. And so today's the day we remember that and reflect on that loss and grieve for those people. But the horror of the AIDS crisis was that so many of those young people actually died estranged from their families, away from loved ones, and that's why community was so important, because community would sit at the bedside. People, friends, neighbours would sit at the bedside of people as they died when their families were not there. And so I think for me, World AIDS Day is that moment where we reflect on the horror of that and hope that we never find ourselves in a situation where prejudice and fear are able to triumph in those ways. Love has got to prevail, and that's what World AIDS Day is really about for me.